What started as a headache turned into a fever and ultimately seizures for 7-year-old Josh Gay. He was rushed to the hospital with his mom by his side, who happens to be an emergency room nurse at Altman Hospital.
She's like, we need to intubate him. And it kind of all hit me, like, this is bad. This isn't just a seizure, this isn't just a fever, not a normal virus.
After a series of tests, doctors had determined it was lacrosse encephalitis.
The results had come back that a mosquito almost killed my child.
Encephalitis is inflammation of the brain, and in this case, the virus was carried by a mosquito.
I mean, there is no cure for it. Prevention is the only thing you can do. Supportive measures are what they do when you do reach the severe case, which is what he had.
There are a lot of viruses out there that can infect humans, but two things that can get really alarming is when a virus spreads quickly and when it causes serious harm. Zika virus has the potential to do both of these things, which is why it's gotten a lot of attention. Given this, it makes sense to understand a bit about Zika virus and the disease it causes. In order to mature her offspring, female mosquitoes need a blood meal, which they get from unsuspecting hosts. Mosquitoes find their blood meals using chemical compounds that we and other organisms give off, like carbon dioxide, ammonia, lactic acid, and octanol. So when a mosquito that also happens to be carrying the virus finds her meal and digs in, the virus infects the human host and starts to multiply or reproduce within the human. With most flaviviruses, though, the virus isn't able to replicate enough in the human host to actually be able to reinfect another mosquito, and so the human is considered a dead-end host. However, the Zika virus, along with yellow and dengue fever, is well enough adapted to human hosts such that it can multiply to a point where it can reinfect another unsuspecting mosquito, which can then go on to infect more people. The Zika virus is transmitted via mosquitoes in the Aedes genus. These bloodthirsty little guys can bite at night, but are mostly active during the daytime.
Today's topic is dengue, an acute infectious disease that is characterized by headache, severe joint pain, and a rash that is caused by a single-stranded RNA virus of the genus Flavivirus, or species dengue virus, transmitted by mosquitoes of the genus Aedes, called also breakbone fever, dandy fever, or dengue fever. Causes. The viruses that cause dengue fever are spread by mosquitoes of the species Aedes aegypti, and sometimes also by Aedes albopictus. According to the World Health Organization guidelines, any of the following symptoms are warning signs that may signal the development of severe dengue, often called dengue hemorrhagic fever, or DHF. Abdominal pain or tenderness, persistent vomiting, lethargy or restlessness, mucosal bleeding, such as bleeding gums or nosebleeds, liver enlargement, fluid accumulation in the lungs or abdomen, as shown by X-rays or ultrasound. Dengue hemorrhagic fever. Dengue hemorrhagic fever, or DHF, is the most serious form of dengue infection. DHF is a clinical syndrome defined by 4 key features. Increased permeability of blood vessels, leading to plasma leakage into the surrounding tissues, and lack of plasma in the bloodstream, which makes the blood more concentrated. Low blood platelet count, fever that lasts for 2 to 7 days. Tendency towards severe or hemorrhagic bleeding. Severe bleeding or hemorrhage isn't the most dangerous symptom of DHF. The most life-threatening concern is the leakage of the liquid part of the blood, or plasma, into tissues surrounding the blood vessels. When this happens, not only can dangerous pockets of fluid accumulate where they don't belong, such as in the lungs or abdomen, but there also isn't enough fluid left in the blood vessels to circulate the blood properly. This inability to circulate blood properly is called shock. Shock is life-threatening and can lead to metabolic problems and organ failure. Treatment of shock requires hospitalization in an intensive care unit, or ICU, for
So news reports reveal that cases of chikungunya have also been spotted in Nevada, Arizona, even here in California.
Ooh, it's coming.
So let me explain this. This is transmitted by the Aedes aegypti mosquito. It's a daytime mosquito, so you can get bit by this thing any single time of the day or night. Oh. Now, what it does is obviously when it comes in, grabs some of your blood, it transmits the virus into your bloodstream. Your initial symptoms are much like that of the regular flu. You might start to develop fever, joint pain, and as the virus spreads throughout your body, you feel terrible. Joint pains throughout your body, your hands, your feet. You can develop GI upset in addition to severe headaches. Oh, man. But the biggest thing, I mean, luckily it's not life-threatening in otherwise healthy people, but the biggest thing is you are literally doubled over in pain. Ooh. The pain is so severe. That's why chikungunya, as you see in that animation there, it actually stands for to be contorted. Oh, because you're doubled over in so much pain.
Yellow fever is a viral hemorrhagic disease like dengue fever and Ebola. It's caused by a virus transmitted by the Aedes mosquito, but only infected females can actually transmit the disease. It bites mostly during the day. Yellow fever occurs in tropical regions of the Americas and Africa. In around 80% of cases, the infection causes no or very mild symptoms, similar to those of the common flu or malaria. They usually disappear within a few days. In around 20% of cases, the disease is far more severe, and other symptoms develop. Jaundice, hence the name yellow fever, kidney disorders, bleeding, convulsions, and even coma. Between 25 and 50% of severely affected patients die. According to the World Health Organization, an estimated 30 to 60,000 people die of yellow fever every year. It's a difficult disease to diagnose, as the symptoms alone are not enough. A blood sample has to be taken and sent for testing at a specialist laboratory. Although the disease was discovered 90 years ago, there is still no treatment for the actual virus.
Asia can be both peaceful and beautiful. However, it can also be full of hidden dangers. These travellers are here to enjoy the stunning scenery. Little do they suspect that it's concealing a killer. This vicious virus is Gen, also known as Japanese encephalitis. A sneaky little bug, Gen can infect travellers across Asia through a single mosquito bite. Japanese encephalitis is a brain infection which can be fatal. It can cause flu-like symptoms and, in severe cases, fever, headaches, an altered state of mind, convulsions, and even death. Survivors can be left with permanent brain damage. To stop Gen ruining your travel plans, visit your nearest convenient pharmacy or specialist travel health clinic a few months before you leave to see how you can help protect yourself against Japanese encephalitis and other diseases carried by mosquitoes. Everybody should protect themselves against mosquito bites.
Thank you, Janice. Yesterday, it was the flesh-eating bacteria in the Gulf. Tonight, health experts are buzzing about the threat of yet another mosquito-borne virus here in the Bay Area. Our Adam Weiner is taking action for you with what you need to know about this latest potential danger.
The stiff neck and a form of paralysis.
Local health experts say St. Louis encephalitis is similar to West Nile virus, as are the mosquitoes that carry.
In terms of the ones that carry chikungunya, they like to bite during the day. The mosquitoes that carry St. Louis like to bite at dawn and dusk.
Maggie Hall of Pinellas County's health department believes the public is struggling to keep up with all the diseases we've been hearing about this week.
Right now we've had news reports of Vibrio, today St. Louis encephalitis, and also we had to deal with chikungunya.
Pinellas for standing water anywhere on your property to get rid of it, to throw it off. As soon as possible, they do become mosquito breeding ground. Live in Pinellas County, Adam Weiner, ABC Action News.
The Rose River virus is a mosquito-transmitted alpha virus that is endemic in Australia and Papua New Guinea. It caused a large epidemic in 1979 and 1980 involving Fiji, Samoa, and the Cook Islands. Rose River virus causes the most common arboviral disease in Australia. Mosquitoes are medically important because they transmit many diseases such as the dengue fever, yellow fever, and Rose River fever. Infection with Rose River virus is most commonly associated with fever, rash, and joint pains. Swelling of joints may also occur, especially in the fingers, wrists, and feet. Rose River fever is also sometimes known as epidemic polyarthritis. General symptoms such as nausea, headaches, backaches, and muscle aches are also common. Lethargy and fatigue are often devastating, with some people which are unable to carry out minor activities or even get out of bed. However, 10% of people have ongoing joint pains, depression, and fatigue for many months.
The deadliest animal on the planet, responsible for the death of billions, the mighty mosquito. Along with other diseases, it plays host to malaria, one of the cruelest parasites on Earth, possibly the single biggest killer of humans in history. In 2015 alone, hundreds of millions were infected and almost 500,000 people died. They're parasites that completely rely on mosquitoes. Malaria always starts with an insect bite. In its salivary glands, thousands of sporozoites wait until the insect penetrates your skin. Immediately after invading you, they head for the liver, where they quietly enter big cells and hide from the immune system. For up to a month, they stay here in stealth mode, consuming the cells alive and changing into their next form, small, drop-like merozoites. They multiply, generating thousands of themselves, and then burst out of the cells. So thousands of parasites head into the bloodstream to look for their next victims, red blood cells. To stay unnoticed, they wrap themselves in the membranes of the cells they killed. Imagine that! Killing someone from the inside and then taking their skin as camouflage. Brutal. They now violently attack red blood cells, multiplying inside them until they burst, then finding more red blood cells, and this cycle repeats over and over. Pieces of dead cells spread lots of toxic waste material, which activates a powerful immune response, causing flu-like symptoms. Among the symptoms are high fever, sweats and chills, convulsions, headaches, and sometimes vomiting and diarrhea. If malaria breaches the blood-brain barrier, it can cause coma, neurological damage, or death. The parasites are ready for evacuation now. When another mosquito bites the infected human, they get a ride. The cycle can start over. In 2015, the Zika virus, which causes horrible birth defects if it infects pregnant women, spread rapidly into new areas around the globe. It too is carried by a mosquito. The mosquito is the perfect carrier for human diseases. They've been around for at least 200 million years. There are trillions of them, and a single one can lay up to 300 eggs at a time. They are practically impossible to eradicate and the perfect parasite taxi.